Then we have clinical services. You can add as many as you want. Yoga therapy, health coaching, other therapy, coaching, non-physician services, longevity, health span optimization, integrative medicine, and so on. And then within those services, we have different kinds of assessments. So there are many of them. Cognitive distortion check. You can look into this. And you can change them all as you see fit. So there's a form builder to make assessments any way you want. But we also help to give you the things that usually are required. Then activities. Activities are little things you can give to your clients. Like for example, avoidance pattern check. So you see explanations, how to use the activity, questions, videos, documents, whatever it is, you can give them activities, and that can help your clients to lower anxiety, sleep better, learn different coping skills, and so on. And there's a huge library of activities: meaningful conversation reflection, weekend sleep shift awareness, tracker, and so on. So if you like one of these, you can just press one button, clone to tenant, and then it's yours. It's in your library, and now you can change it and mention your clinic name or your coaching program or whatever it is. So it's completely individual. You can also create from scratch new activities, and then you can add those blocks here: PDFs, video embed, audio, image, reflection prompt, journal, single question, and so on, checklist, rating scale, signature capture, file upload, and so on. Even an assessment launcher to launch out of those activities an assessment like GAT-7, also like anxiety. Then another level up, you can create care plans. Like a care plan is a sequence of events over whatever time span, like a week or 3 days or a year or many years. And those care plans have those different elements that are done by the nurse, by a doctor, by a Ayurveda practitioner, by a yoga therapist, by a yoga teacher, meditation, you name it. So you can freely structure this. Who's doing the things? Often it's the coach and the client. It's either the coach is doing it or the client is doing it. And so you create those tasks, and then you can go to your patients and then assign those care plans to them. So this example patient we have here has like so many care plans. And then the patient will be automatically invited to participate or to watch videos or to learn certain things and so on. So it's very, very sophisticated and automated. So you can do very good client care by preparing your programs and then have them automatically applied. And so when you see something like an activity, for example, where you say, oh, this would be good for my client, then you can just assign it here. This assignment, you can even set like a due date, and then it will be applied to that patient.